Identification of RMP and patient.
So RMP has to identify and recognize that whatever patient is talking to, he knows that his identity is confirmed by the either Aadhaar card or photo identity card. You cannot do anonymous. Neither yourself nor the patient.
Yeah.
Both of them have to identify themselves, and especially when there is another RMP involved or another caregiver is involved, so that there are errors of nomenclature or identifying the patient doesn't happen.
So there are 7 elements to be considered before any telemedicine consultations. So what are these 7 elements? So first is context. Important again, the whole context, whether it is they are not able to come physically and all those things. So context has to be very, very clear. Identification of RMP and patient.
So RMP has to identify and recognize that whatever patient is talking to, he knows that his identity is confirmed by the either Aadhaar card or photo identity card. You cannot do anonymous. Neither yourself nor the patient.
Yeah.
Both of them have to identify themselves, and especially when there is another RMP involved or another caregiver is involved, so that there are errors of nomenclature or identifying the patient doesn't happen.
Yeah.
Especially during the prescription, during giving the drugs, and if the patient is a minor, especially it is important because you have to take an age proof also, as well as his parents or somebody who is a responsible person should be available. Then only you should do the telemedicine consultation. And finally, you have to display the registration number at all the documents which you are showing him, whether it is WhatsApp, whether it's email, any electronic communication. You have to give your medical council registration number.
And RMP, the mechanism, the whole guideline is not clear about which document to be like sure about the identity. It could be PAN card, it could be Aadhaar card, it could be voter ID. It is up to the RMPs only. Okay, so it is written that RMP should ensure there is a mechanism for patient to verify the credential and contact details of RMP. So it is up to the RMPs to actually get it like verified by different mechanism. There is no guideline. Okay, only this document will be sufficient.
But it is important to keep the records. The most important thing in this telemedicine is to keep all the records.
Absolutely.
Whether you're identifying it properly, whether you have taken the consent, whether if the patient was minor or major.
Correct.
Did you ask these things? Did you confirm that there was no care available close by? All
Correct.
these things are very important. So it is a digital record keeping, and you have to keep it properly.
So we will talk about this record keeping, very important. Okay. Mode of communication, it could be video, audio, and text. We have talked about consent. Now consent is very important. Now consent like implicit, like if the patient initiate a teleconsultation, then it is consent is implied, just like a walk-in OPD, right? This is a consent. So when there is a walk-in OPD, you don't take a consent because he or she has already come. Explicit is like explicit patient consent is needed if a health worker or another RMP or a caregiver initiate a telemedicine consultation. So whenever there is a in-between person or directly you are talking to a patient, you take a consent before, like you are comfortable or who is in between, you have to take directly from the patient. And explicit consent can be recorded in any form. Patient can send an email, text, audio or video message. Okay, or video or audio, just ask him that this is a teleconsultation call. Are you comfortable with it with going forward? Yes and no. That's it. These are a set of questions or set of lines when you are discussing audio and video. These are the things we should be taking care of it, because then any problem you will be like saved if you have gone through this process. Type of consultation, first consult and follow up, right? It could be first or it could be a follow-up.
We recommend is that first consultation, if it is possible, it should be a physical consultation, and it should be mainly used for the follow-ups. So they are the best, you can utilize best there. Or if you are using it as a first consultation, you should ask the person to come in physical if he can in a short span of time. First consultation is the primary consultation where you make the diagnosis, where you should be very, very sure about what you are starting on a patient. Once the diagnosis is confirmed, it is easier for the follow-ups to go on the digital platform.
Then the patient evaluation happen as normal. Nothing to add here. 7th point is patient management. Patient management is like you can educate, you can counsel, and you can prescribe medicines. Medical ethics and data privacy is exactly same. Okay, there is nothing. You have to abide by IMC ethics regulation 2002, and in addition IT Act of Data Protection and Privacy. These are the 2 acts which will guide you in the teleconsultation. Registered RMPs will not be held responsible for breach of confidentiality if there is a reasonable evidence to believe that a patient privacy and confidentiality has been compromised by technology breach or any other person other than RMP. So you will not be held liable for that. Now maintain a digital trail and documentation of consultation.
It is incumbent on the RMP to maintain the records from time to time. So important is to maintain the record of telemedicine interaction, whether it is a phone log or an email record or a chat or a text record or a video logs.
Right.
So preferably you should use the medium which are having recording facility. Make the life easier for you. Something like Zoom or maybe Google Meet, they have recording facility. So you should make it sure that whatever medium you are using, whether it is an app-based thing, you should have to have records, and it should be easier because there will be a lot of records if you will do telemedicine on a regular basis.
Fee for telemedicine consultation as you deem fit. There is no guideline for it. Yes, if you give a receipt and invoice, your registration number and everything as you in the physical world, it has to be taken care.